Now, the difference in news and information in Arkansas. This is THV 11 This Morning.
It is Medical Monday, and we're discussing children and eye health now. Dr. Dan Hennessy with the Little Rock Eye Clinic joins us now to talk about how good vision can help a child's physical development, success in school, and even their overall well-being. We're so glad to have you with us today, Dr. Hennessy.
Thank you. Happy to be here.
Important topic, especially as most kids are officially back in school right now. We have some graphics that we want to show as well. What are some signs of vision problems that parents need to be on the lookout for with their children?
Well, some of the things that are most important as kids go back to school, they may come home and complain that they can't see the board at school, that they have eye strain when they read or get headaches when they read. But some of the things that parents can look for is if a child will close or cover an eye when they're reading. Sometimes that can even be as subtle as turning their head and reading with one eye. They may complain of blur, they may squint, they may rub their eyes a lot, they may blink frequently, those types of things.
Okay, so those are things that as parents it's important to be watching for closely.
Correct. With
your children. Another thing, of course, it's probably best to check out your child's vision before a problem arises. But when do children actually need to have their eyes checked?
Well, one of the things that's most unfortunate is that nearly 80% of preschoolers never get an eye exam before they begin school. And that ends up causing some potentially permanent loss of vision. So what we recommend is that all children should have their first exam as a newborn. That's going to be done by the pediatrician. Second exam, somewhere between 6 months and a year old, that can be done by the pediatrician as well, but also can be done by their eye doctor. And then around the age of 3 and the age of 5, they should have a thorough eye exam by an optometrist or an ophthalmologist. If their eyes are fine at that point, then they can go every 3 to 5 years. If they're already in glasses or needing help, then they're going to be probably examined once a year.
Okay, so what you're saying is really by the time your child starts preschool, kindergarten, they should have had their eyes checked already almost 4 times.
Absolutely.
Really, if you're going to be correct about that as well. And now when kids come in to see you, what do you notice the main problems being? Do they come in and say, you know, Dr. Hennessy, I can't see the chalkboard as my teacher is up there?
Sometimes they will, and particularly if they're old enough, they'll do that. But with the younger kids, they don't have a point of reference as to what they might see or shouldn't see. And so we're going to do some things that are looking for problems like strabismus, which is where the eyes don't properly align with one another and one eye may drift out or drift in. We look for high degrees of difference between the two eyes, one eye being very nearsighted or farsighted compared to the other. We also are looking for high degrees of astigmatism in one or both eyes. And all of those things can cause problems that we lump into a category of amblyopia, what people often call lazy eye.
Okay.
These are problems that if they're detected early in the child's life, corrective lenses, patching, occasionally surgery can prevent a permanent loss of vision.
Okay, important to get your kid checked out for all of this. Dr. Dan Hennessy with the Little Rock Eye Clinic. Thanks so much for coming in today.
My pleasure.
We appreciate it. And you can find more information at littlerockeye.com.